Hello there, welcome to the World of Sustenance where your academic needs are met. We don't come again, we'll continue our lecture series on pregnancies, on maternal and child health. So the topic today is pregnancy science and psychological changes. So the idea now, what's the idea about this topic? What's this topic they talk about? Imagine you have a woman, let's call this woman Miss Jones or Miss Titi, and she tells you, doctor, my nurse, I feel some kind of way. I feel like something is wrong with me. Do you think I'm pregnant? So, you as a healthcare provider or healthcare practitioner, what will come to mind first? You look into the possible signs of or the signs of pregnancy. So these signs of pregnancy can be divided into three. They include the presumptive, the probable, and the positive signs. You understand? So how can we remember this? It's very simple. Presumptive means the feeling that the woman has or the lady has. You understand the feeling. You understand the feeling that the changes in the feeling that the woman has. So this include the presence of amenorrhea, nausea and vomiting, fatigue, urinary frequency, breast changes, quickening. So for the first one, amenorrhea means the absence of menstrual flow. You understand, when the woman does not see her menses. So that's one of the things that could trigger, wow, are you sure I'm not pregnant? Okay. Then the next one is the morning sickness, which is the nausea and vomiting. The next one is fatigue. I'm always tired. I cannot move. I'm always tired. I always want to sleep. You understand? Then the next one is urinary frequency. I'm always going to pee every 2 seconds. I don't go piss. Then another one again is the breast changes. When the breasts become fuller, become bigger than normal. Then the quickening means they're like fluttering movements, like you feel that something is moving your abdomen or pelvic region, and this happens around 16 to 20 weeks of pregnancy. And all of these are the presumptive signs, are the feeling that the woman has. You understand? These they cannot be used as a form of detecting if a person is actually pregnant. You understand? Because all this can be as a result of other reasons or causes. Like for example, stress can make cause amenorrhea. Even infection, some certain STIs or UTIs can actually cause that. Even fatigue too, stress can cause fatigue and so on and so forth. So the next type now of the signs of pregnancy include the a more certain but not definitive. You understand? This is a more certain type of signs. This one includes the Goodell sign. This one means the softening of the cervix. You understand? When the cells becomes when it is observed, it becomes very soft. You understand? So that's what is called the Goodell sign. The Chadwick sign on the other hand is the bluish appearance on the cervix. When it is observed under, you don't use the spectrum to observe the cervix. It becomes bluish in nature. So that is the Chadwick. Then the Heger means it becomes softening of the isthmus of the cervix becomes soft. You understand? So that's the Heger sign. Then the Braxton Hicks contraction. These are the forced contractions. You understand? Like forced labor signs. Then the positive pregnancy test too is also under this probable sign. So very, very important, because there can be false positive results of this pregnancy test. Then the next one is the palpation of the fetal outline, even ballotment too. These are all under what's it called, under the probable signs. You understand? So the ballotment means when you tap the cervix during a vaginal examination, it may cause the fetus to rise, then rebound to the original position, make it to rise and make it like to trigger the fetus to move. You understand? And still come back to where it was before. You understand? So these are the probable signs. You understand? So very, very important. They're not actually a certain sign of or certain reason that this person is actually pregnant, but they are like better reasons that okay, this person is pregnant compared to the presumptive signs. So the positive ones now, to be sure that the person is pregnant, there will be fetal movement. You understand? This can be detected by an examiner, either a nurse or a doctor. You understand? Through palpation. So very, very important. Then auscultation of the fetal head a heart sound now too. You can use a Doppler to listen to the sound. And even you can even use an ultrasound scan too, like this image depicts here. You understand? So the visualization of the embryo too, also occurred using the ultrasound scan. So what they talk about since I say they get 3 types of signs of pregnancy. You get the one we say they show off at all, maybe the presumptive signs, because those ones they can be they caused by different reasons. You understand, like infection and all those things. For example, now be amenorrhea, nausea, vomiting. Then the probable now, the ones we say they a little bit more certain, but they don't be say they be exact signs or say they be the weird thing. And then the next one are the for now be the positive signs. Then be the cocoa say okay, this person get belay. You understand? So very very important. So moving on, let's see. I know I've adopted a different technique now. After every lecture, we'll look at a positive, a possible question that we can get from this area. So let's just quickly look at it. A 28-year-old woman presents to a clinic reporting a missed period, breast tenderness, and fatigue. On examination, the nurse notes a bluish discoloration of the cervix and vaginal mucosa. Which of the following best describes these findings? A. The breast tenderness is a positive sign of pregnancy. B. Bluish discoloration, which is Chadwick sign, is a presumptive sign of pregnancy. C. The missed period is a probable sign of pregnancy. D. The bluish discoloration, Chadwick sign, is a probable sign of pregnancy. So, from all we have been doing so far, what do you think the answer or answers to this question would be? So, thank you very much. I remain sourcing it. Don't forget to send your. Well, before I go, I'll actually talk a little on the last part of the topic, which is the psychological journey. The first trimester, what happens in the first trimester? The person may be shocked, ambivalent, doubtful because of the hormones. The person might be having mood swings. That period, the person will be telling me, I'm even tired of this whole process already. You understand? So that's the mood swings and all. Always getting angry. Then the second trimester, on the other hand, now this is called the honeymoon phase. This is where the person is happy that the person has accepted that I'm going to give birth to this child no matter what, and the person is peaceful, and baby moves, and the bond actually deepens. You understand? So the next one is the third trimester. That's when the person gets scared. The anxiety also increases because the people, some of the pregnant women will be checking videos on YouTube. We've seen some complications that happen during pregnancy and become scared, and the person has to finally make up their mind to be ready to deliver the baby. So thank you very much. At this point, in case you have any questions, you can send them on as comments. And thank you very much. Share to your friends and your colleagues. Remain sourcing it. Thank you very much for watching.